All right, so let's start with the big story that we are tracking on WION at this hour, where a fourth wave of COVID-19 infections is sweeping across Japan. And this has now cast some serious doubts on the Summer Olympics that are slated to be held later this year. Well, Japan is set to expand the quasi-emergency measures to 10 regions, including the metropolises of Tokyo and Osaka. Now, the quasi-state of emergency allows the local governments to actually order bars and restaurants to shorten their hours and also impose fines on those who do not comply. A final decision on the measures is expected sometime by later this evening. Now, over the course of the pandemic, a full state of emergency has been declared twice in Japan. Japan's top health experts have acknowledged that the COVID-19 pandemic is now officially in its fourth wave, driven by a virulent strain of the British mutant virus. Now, the daily cases in Osaka has now reached a record 1,208 on Thursday, and new infections have risen by about 729 in the city of Tokyo, which is the highest since early February, when much of the nation was under a state of emergency. And also in a commentary that was published in the British Medical Journal, health experts have written that Japan's inability to contain the COVID-19 pandemic means that plans to hold the Olympics in Tokyo should be reconsidered. Experts have also said that Japan has in fact exhibited a pretty poor performance in containing the virus transmission, along with limited testing capacity and a very slow vaccination rollout. Japan began its inoculation push in February, which was much later than most other economies, and just about 0.9% of the Japanese population has received its first shot of the vaccine so far, in comparison with nearly about 2.5% in South Korea and about 48% in the United Kingdom. Now, already delayed by over a year, the 2020 Games are due to begin in fewer than 100 days. A scaled-back torch relay is also underway, and overseas fans have been barred from the Games, and officials say that domestic fans could also be kept out. A senior ruling party official has already said that cancelling this year's Tokyo Olympics is an option that the government could consider if the coronavirus situation becomes too dire. But Olympic and also the government officials have said that further postponement of the Games is simply out of the question. Well, the Japanese Prime Minister Yoshihide Suga has said that the government to do everything that it possibly can to prevent further contagion ahead of the Games.
安全安心の大会の開催に向けてしっかり支えていく、その考え方に変わりはないというコメントを出されております。政府としても開催に向けて感染防止に万全を尽くしていきたい。これは変わりません。
Now, Tokyo's residents have in fact expressed concerns about holding the Summer Olympics during the COVID-19 pandemic. Listen in to what some of the local residents have had to say.
やって大丈夫かなって思ってますけど、別に私はそんなに興味はないので、やめるんだったら早く決めた方がいいなと思ってます。
正直あまり賛成ではないんですけれど、もしやるからにはしっかり対策をしないと、ちょっと不安だなっていう気持ちはあります。
All right, now to give us more insights in terms of how bad the situation is actually in Japan, we are joined in by our correspondent Phoebe Amoroso, who is joining us live from Tokyo. Thank you very much indeed, Phoebe, for joining us on this broadcast on WION. So how bad is this situation actually? So Japan has now officially said that it is experiencing the fourth wave of COVID-19 infection. What are the infection rates like in Japan?
So yeah, as you said, government experts said on Wednesday that Japan is in a fourth wave, and it was quite a departure from the situation last week in which it started with Prime Minister Suga saying we're not at that stage yet, but cases are going up day by day, and nationwide cases are topping 4,000, the highest level since January, and the main source would be Osaka, which is, as you reported, over 1,200 daily cases. The concerns really are that this time the fourth wave might be different, and in fact the head of the government advisory panel said we should be taking things far more seriously because of the spread of new variants. the people are getting more seriously ill and it's spreading much more quickly. The governor of Osaka has said that hospital beds reserved for those who are seriously ill are reaching their capacity. And even a new hospital that opened in December, it has beds for seriously ill. They've not been able to get enough medical staff to reportedly to be able to use all of those beds. So there is a concern as to how far cases are going to rise, and that's why from today the government has is going to decide from this evening, but is expected to announce that 4 more prefectures will come under a quasi state of emergency, which allows prefectural governments to ask businesses to close by 8 p.m. and to enforce fines if not. But one of the biggest issues is risk communication, so that there's not too much difference between a state of emergency and a quasi state of emergency. It relies on the public and the public's cooperation. But there have been reports that there's just a lot more foot traffic. People are getting tired of the pandemic. So it's hard to communicate to people, how they should behave during these times. And that might be a struggle facing the government going forwards.
All right. And also, Phoebe, one of the questions that a lot of people are, in fact, wondering is because the Olympics is, in fact, already been delayed by a year. What is the possibility that the COVID-19 pandemic, and also because of the fact that the infections still seem to be spreading at this point of time in Japan, how is it likely to impact the Olympics that are slated to be held later this summer in Japan?
Well, as you said, we've already seen a huge amount of impact on the Olympics being postponed by 1 year. And there have been already test events cancelled. Technical staff that were supposed to be overseeing the water polo events were not able to come into Japan due to travel restrictions. And we're likely to see a lot more caution going forward now that Japan is in a 4th wave. And the biggest issue currently is the debate over spectators. Last month, the Japanese government took the steps to ban overseas spectators from attending the Olympics. And there is a debate now with the 4th wave in Japan, what to do about domestic fans. Taro Kono, who's the head the minister overseeing the vaccine rollout program, said earlier this week that an Olympics without domestic fans could be possible. But Seiko Hashimoto, who's the organizer, the head of the organizing committee, said that maybe at 50% capacity the games can go ahead. So it's not really sure how it's going to proceed. And currently, Japan's vaccine rollout program is far behind other major economies and other countries, in that less than 1% of the population is currently vaccinated. They started rolling out vaccines for the elderly earlier this week. But there's a big concern as to how to prevent the spread when people are clearly going to gather to watch the Olympics. Already, sections of the Olympic torch relay in Osaka, and just being announced that Okinawa is also thinking about similar measures, moving that segment of the relay from public roads into a park, into a private space where fans cannot attend. So we're already seeing a lot of precautionary measures, and that doesn't bode well for the Olympics. And as you reported, one of the top officials in the ruling LDP party has said in an interview that it's possible that the Olympics could be cancelled, and that's causing a lot of speculation here and a lot of concern.
Absolutely indeed. My final question to you, Phoebe, is why is it that the vaccination rollout in Japan has been so slow?
So in terms of the vaccine rollout, Japan has been quite slow to approve vaccines. The Pfizer vaccine was approved. Moderna is still waiting approval. And then there was also concerns over securing enough shipments. The government negotiated earlier this month to get larger shipments of the vaccine to Japan. Then there's the rollout, which is done on a prefectural basis. And the head of the vaccine rollout said that prefectures had actually requested him to proceed slowly so that they could organise their systems, get the right sort of technical training in order to be able to track the vaccine rollout. There's also been some issues with the syringes that the Pfizer vaccine comes in a vial where you can extract 6 with the right needle, but Japan was unprepared and could only extract 5. So that in the early days caused some concerns as to whether there'd be enough. The government has secured enough now, but it's still going forward quite slowly with the rollout program. And it's a bit of it's still unknown as to when the general population can expect to receive their vaccines. But now the sense of urgency is definitely increasing.
All right, we'll have to leave it there. Thank you very much indeed, Phoebe, for joining us and getting us all those updates there. WION is now available in your country. Download the app now and get all the news on the move.